Hi guys, Dr. Cliff here with HearingLoss.com, and in this video, I'm talking about person-centered audiologic care. Receiving optimal benefit with hearing aids requires three main things: the right hearing aids, audiologic best practices, and person-centered care. The majority of people with hearing loss think that success with hearing aids is all about the technology, but that could not be further from the truth. The most successful hearing aid users are the ones that go to a hearing care professional who follows best practices using a person-centered care approach. Now, I talk a lot about best practices, and if you want to learn more about them, make sure that you check out this video on the HearingLoss.com YouTube channel. However, one thing that does not get enough attention is the concept of person-centered care. You see, best practices are procedures that must be followed to ensure you receive the maximum benefit from your hearing aids. But person-centered care is the manner in which your hearing treatment is selected and administered. Generally speaking, person-centered care is when your hearing care professional takes your wants, needs, and values into consideration when making treatment recommendations and includes you as a joint decision maker in the treatment process. This means that your provider should be spending a significant amount of time with you, finding out what's most important for you to be able to hear and why. Then presenting you with your best treatment options so you can both work together to identify the option that is most ideal for you. This model of care delivery is significantly different than the traditional medical model, where your provider just looks at your audiogram and makes a general recommendation for treatment without really knowing anything about you. However, person-centered care does not stop after making a treatment recommendation. Person-centered care also means that your hearing care professional should be explaining the decisions that they're making during your hearing aid treatment. By the time you have completed your hearing aid fitting, you should know exactly what treatment decisions were made and why. This person-centered care approach should continue throughout your time as a patient during your ongoing follow-up visits. When done correctly, person-centered care will ensure that you get the best hearing aids for you, that your wants, needs, and values are being taken into consideration, and that your hearing loss is being treated the best way possible. This way, you never have to question whether or not you could be hearing better. If you would like to learn more about your hearing loss and person-centered care, make sure that you like and subscribe to the HearingLoss.com YouTube channel to catch more of our informational videos.